Hello and welcome to my podcasts. My name is Nika and I am interested in biomedical sciences. Today, my guest is Professor Giorgi Pkhakadze. He is very well known in Georgia and internationally in the field of public health. To begin with, Professor Giorgi Pkhakadze, could you tell us more about yourself?
Hi. First of all, thank you to be part of your podcast. I really like your initiative. I think it's very great, and I hope that to support Georgian youth and to make sure that your generation will be interested in the sciences, particularly biomedical sciences, would be great because this is the way we go further. So, regarding myself, I'm a doctor. I'm a trained surgeon, and after I did my master in public health, and after I did my PhD in public health and anthropology. And I work as a doctor. I was as an emergency I fellowship in emergency medicine, so I know a little bit about medicine. And for different, for my last 20 something years, okay, its age is ticking. I work with different UN agencies. I was in Africa and Asia and Middle East and Central Asia, and now I'm based in Geneva, working with the World Health Organization. But at the same time, I'm keeping my roots in Georgia. I'm a chair of the Public Health Institute of Georgia. We have one of the biggest public health media holding. We have a 22 websites, 17 Facebook pages. We're doing extremely interesting job. And we're doing things like promotion of the health to the population. And also as a Public Health Institute of Georgia, we are partnered with Accreditation Canada. We're doing the accreditation of healthcare facilities in Georgia. And this is a really interesting process. But this is all connected to my previous job because I used to manage more than 45 private hospitals in Georgia. And after I was a clinical director of 20 private hospitals in Georgia. But this is all connected to my international experience. And the biggest one, I think that's what is most important was I was advisor. I was a member of independent accountability panel for the Secretary General of the United Nations, where the group of 10 appointed by the Secretary General, the last 6 years, we provided advice to SDG 3. So the health related issues. So this is what was my goal. But also I'm still member of their technical review panel for the Gavi Alliance, more than 10 years. And before I used to be the also technical review panel expert for the Global Fund for Tuberculosis, Malaria, and HIV. And with the Gavi Alliance, go back to it, I'm a member of IMC, Advanced Market Commitment for the pneumococcal vaccines. So I'm very much involved in the vaccinations and HIV, tuberculosis, malaria programs, and with WHO, now I'm working on the competency standards for health workers, working with the refugees and migrants. I developed the e-learning course, which is now available in WHO Academy. You can actually download it and to get the very good certificates. And yeah, I was traveling. I conducted more than 20 trained more than 600 people in Africa and Europe. So, and now in Middle East, 5 countries. So just moving forward. But to your question, I'm still attached to Georgia very much. I'm professor in public health at the Udemy Medical University. So this is something for 2007. I'm very much attached to this university. And I believe to support a young generation to give information about the health and to trick their interest in public health, which is, everybody wants to be a surgeon like me. I used to be. But public health, not so many people interesting. But thanks to COVID, you remember this horrible time that I was every day and broadcasting every day in the TV and every day with all the news agencies. During COVID, more than 3,000 articles have been published with my beautiful face in the brackets, of course. So this was really a trigger point to say, like, this is important to support public health in the country. And as I said, like we creating different projects within the Institute of Public Health Institute of Georgia. Like we create more than 715 reels, or there's 30-second videos about the health issues. We publish 160 booklets for the patients. We create patient.g. This is a special dedicated website for the patient. We created patient councils in hospitals when the patient can participate in management of the hospitals. And we're doing many other things. And the very last project we started 10 years ago, literally. It's kind of integration will be in your podcast. We started Fact Check Health Georgia. And actually, the first victim of our fact check was, this nutrition test equipment, which is like completely ridiculous Chinese garbage machine, which pretend to be checking the substances in the product. And we started this campaign 10 days ago. And actually, yesterday, the pro-government TV channel IMEDI, which is biggest TV channel in Georgia, and 8 Hours News, they actually prepared a program where they say that the National Agency for Food and Safety, they say that these tests are not good and they are dangerous, so please don't follow them. And they actually copy and paste exactly the message what we use through our media holding chain. So this is something very, very good to see. Like when you have evidence, when you write, you push, and finally the government agency, government TV pushing this information, and now majority of population in Georgia, they know that these tests are fake and please don't use them. So this is what we are doing now. So this is very shortly, but this is not all what I'm doing, but at least for this podcast will be here. And I will be very happy to answer to all your questions.
Thank you very much. Professor Giorgi Pkhakadze, you started talking about Georgia, and from your perspective, what are the biggest public health challenges in Georgia right now?
There are several. I think the biggest challenge what we're facing, it's all related to the behaviors of the Georgian population. I think the first is a public health emergency. It's a drug use. The drug use, it's a public health challenge. And for the last 30 years since we become independent, no any proper adequate solution been proposed, because politicians, they try to play their own games and nobody is really thinking about their population. As you know, the drug addiction is chronic relapsing condition. When person once already become drug addict, it's for life. It's not like, oh, I'm stopping today and that's it. No, it's not like that. So, and the society should think how we can work and how we can integrate these people within the society, and not to reject them, but to include them. It's expensive, it's difficult, and is a mindset changing process required within the society, which is very difficult. The second, I think that what we are facing is other behaviors like smoking. Georgians are still smoking, and this is incredible. We have tons of evidence that smoking is horrible. It's killing our lungs. We have the evidence. But the unfortunate tobacco industry is still very, very strong. And unfortunately, even some of our former ministries of health of Georgia, they even promoting so-called whatever. I don't want to mention this company name. I don't want to give them publicity. So they are actually promoting this company's ideas. So the now tobacco industry moving from cigarette, they say, oh yeah, cigarettes is very bad, but we do harm reduction, and so we actually do. Oh, you can use IQOS, but we know the IQOS is very dangerous as well. So, and unfortunately, this is where we stand. So this is like two behavior things was we have bigger challenges. The next one is nutrition. Nutrition, the food. Georgian food is great. However, we're forgetting one thing. The Georgian food is really tasty. It's very nice. But our common food, what we're now eating now, khachapuri, which is beautiful. It's like a calzone pizza, but only with cheese. Issue is that this food was actually served during the big feasts. It was served maybe a couple of times a year. People will, when we eat this food, it was wow, it was something very special because it's very rich. You have a cheese, you have a butter and everything, but you really take it once, like maybe once a month or maybe once every 3 months. Nowadays, people eating it every day. As a result, it's a disaster. So salt intake, we're taking too much salt. And we know this the problem with the salt. And the sugar. Sugar is another problem. Is that our sweets are too sweet. So, and the way how we eat food, it's not exactly the way how we should follow the things. So this is the food thing, what we are talking about. So we have the behavior and the physical exercises. Physical exercises and other issues what we're facing now. It's very good that people are very much interested in physical exercise. However, still, it's not very common for Georgian population to go outside and walking. When people say, oh, I go outside, people go by car. They really go to picnic in the car, and like 10 meters from the car, they will put the feast and they're eating there. So they're not actually exercises. They're not really walking. They're not really hiking. And this the lack of physical exercise in Georgia, this is the public health concern. But if you look all of this together, so it's coming from the schools, because in the schools, we as a nation, we never thought about this, how we can fix this problem, because food is coming from the school. Yes, whatever your mother prepare you food is considered best in the world. However, we also know that even in the school, the children will get proper food and they learn how to do the food. They know the ingredients, they know the reason. Look at Japan. You know that Japan is the less obesity in the world. The reason is very simple, because the kids participating in food making, they're participating, they're doing gardening. And this is the process, and they're eating healthy food. And of course, the sugary food. I mean, this is disaster. When you talk about all this Coca-Cola, Pepsi-Cola, Fanta, and all these ridiculous foods, which should be banned completely. They are as dangerous as narcotics or the tobacco. Unfortunately, we still feeling that, oh, yeah, it's a little bit, and Diet Coke is that even dangerous, even more dangerous. So we have this nutrition problem, we have a behavior problems, we have and on top of all of this, we have a fake news. The fake news, they say like, oh, for example, D vitamin deficiency is the biggest problem. I'll give you one example. D vitamin deficiency is a huge problem all over the world. Majority of this because people sitting in the homes, they in the offices, and they're not getting sun. And they don't get the proper nutrition, they're not getting fish. So they are fast food or whatever, and they do have deficiencies. Like in Australia, I was talking to my friends. The 4 million Australians, they have a D vitamin deficiency. Can you imagine? This is official statistics. Unbelievable. So as a result, fake news, what they do, the people create some kind of pills. They say, oh, you take the pills and you get oh, you have to do D vitamin test. Oh my God, I will do free of charge for you D vitamin test. And they say, oh my God, you have a deficiency. What do you have to do? You have to take the vitamins. Research shows, unfortunately, that just supplements, they are not able to provide the vitamins. There is research shows that even the people who taking the vitamin supplements, I'm talking about supplements, not the drugs. It's a different story. The drug is a prescribed D vitamin is different, and supplements is different. So, and the research shows that really, if you want to get D vitamin, you need to have a 30 minutes sunlight and eat fish. That's it. Simple and easy. But all the supplements, unfortunately, is just big fake. Like, for example, another fake what we are facing. In Georgia, we have a C hepatitis problem. The government used to say that 200,000 people are infected in Georgia. Okay, these numbers are very doubtful. So finally, this was not exactly correct number. It doesn't matter. But matter is that the companies, some private companies, they try to capitalize on this. And what they do, there is one company in Georgia, they say it's called Health Hub. And what they do, these guys, they bring the Chinese tests. By the way, in China, not everything bad. Even the iPhones are made in China. However, this Chinese company, what they brought, this Chinese company has no any certificate confirming the quality of the tests. And even this Chinese company was tested by other independent researchers, and they identified that only 45%, even less than 45% of the rapid tests, whatever they produced, they've been correct. And this company actually proposing, can you imagine, for 35 lari, they're proposing 3 tests or 4 tests. I don't, just ridiculous, like HIV, Hep C, Hep B, and syphilis, whatever. And they're writing in the website it's 99.99 effective test. Rapid test, they're never 99.99. It's a fake. So this kind of fake news we are living in. And it's kind of challenge because people see, oh, I have to do the tests. And the fake guys provided the fake test. Oh, I need the vitamin. And you have some fake guys propose you the vitamin, which is not helping. And the most dangerous thing from public health point of view, people think they're safe. People think they're getting good drugs, but in reality, they're not. So this is the challenges what we're facing now.
Professor Giorgi Pkhakadze, uh, could you tell us how do these challenges compare to global public health issues?
It's everywhere. It's not only in Georgia. Georgia is a small part of the big global market. And these challenges are everywhere because the big corporations and big companies, and the small companies are, they're doing not very, I mean, they're profit driven. This is the thing. In public health, we are people driven. And the companies, they are profit driven. And if they say, oh, we are pro people, come on, give me a break. That's why in healthcare, my experience shows by managing 47 private hospitals in Georgia, I do have experience. Our company went to the London Stock Exchange primary listing, so I know how it works. And my conclusion is that healthcare should not be private. Healthcare should be managed by state and it should be not for profit. The society should contribute and it should not be for profit. When doctor prescribe any medication, this medication should not be for profit. This medication should be pro-patient, pro-people, but not pro-profit. In Georgia, what we are facing now, unfortunately, a majority of doctors, more than 90%, they're all getting kickbacks from the old prescriptions, what they give to patients. It's a disaster. So they give, if they're working for one corporation, they give in the drugs which are available on that particular corporation. Because in Georgia, it's the only country in the world where you have one company, not one, several of them. So the company they're producing drugs, they're exporting drugs, they're packaging, repackaging drugs, they're distributing drugs. They have pharmacies, like 300, 500 pharmacies all over the country. They have ambulatory clinics. They have health insurance companies. They have hospitals, and even now they have medical universities. This is disaster, and this should be stopped. And I think that more time goes, more I convinced that state money should not go to the private hospitals. Private hospitals should manage themselves. They can do whatever they want, but all state money should go to the government hospital. Government should have a reference strong hospitals where the doctors who work there, they will not think about the profit. They think about medicine. They think about the science. They think about how to save the patients. And they will not think that, oh my God, what is the cost effective thing? If the doctors talk about cost effectiveness, this is disaster. How the life can be cost effective? Life is priceless. And when you put cost on the life, this is where we are in trouble. So unfortunately, the Georgia went a very wrong direction. And this is what I say. So this is not just one simple thing. It's a very complex issue. And we have a problem with globally. It's not only in Georgia that when you have a private sector come in, they see profit. And we see this in the US, we see it in Europe, we see it in Asia. Whenever private sector coming in, they're interested in profit. They will cut quality to gain the profit. And as a result, the patients are suffering.
Professor Giorgi Pkhakadze, why do you think unproven or miracle cancer treatments gain so much popularity despite the scientific evidence against them?
No, usually what we fact that in Georgia, particularly, we have very strong Russian propaganda. It's like really, we have this called, it's very funny thing. So it's called, one of the things now in Georgia is like, oh, the Siberia power. I mean, like, I was interested, what the hell is that? It's just completely fake thing made by the Russians. Clever guys know how to do marketing, and they try to convince. Or you have another guys. Oh, I bringing the special. You are part of the program, and this program is from Germany, from Switzerland, from France, and the reality is just supplements, and nobody knows what is inside the supplements. So usually it's marketing. We have these TikTok doctors completely, they have no experience, they have no evidence, they have not even degree, and unfortunately some of them are really doctors, but they don't have an adequate degree. It's like, for me, imagine if I am eye doctor, I'm eye surgeon, and you tell me, okay, now you have to do the neurosurgery. It's a two different thing. Even this doctor, but it's not the same. And these people don't understand that unfortunately some doctor, for example, Health Hub, it was two doctors who did the publicity for that. I was really disappointed. That's why when things like that happening, we have to have a strong regulation in the country. When the doctor promoting fake stuff, their license should be taken off. They should lose their diploma. But we don't have the system in place, unfortunately. But they are harming people. Or for example, I remember, you know, this guy. You have some doctors who are just MDs, very good one. They can speak very nicely. They look very cool with tattoo and whatever. They look very cool. However, they are only just MDs. And I have a PhD in public health. So I have a master in public health, a PhD. So I know a little bit better. And when MD was no international experience in public health, who don't know how the public health functions, criticize me, or even the putting some articles. There is a one politically motivated website called Fact Check in Georgia. Unfortunately, it's a politically motivated one, so I was not surprised. And they write an article about me because when I saying publicly the Chinese vaccine are not effective, and it says publicly, say like, please, we should stop to use them. We should use Pfizer vaccine, which we have in the country because it's much more effective based on the evidence what we have. And what we have, they put as an expert, can you see, MD. And MD criticized me. I'm like, this is something what in Georgia we have a problem that you have to find a peer. What is a peer? So the PhD can criticize another PhD, but also even PhD from the neurosurgery and ophthalmology is different. So you cannot compare apple and egg. It's completely different. So, and this is what we have in Georgia, and then you have people who have no experience whatsoever. Or you have another guy, he's in US. I have no idea what he's doing. He's a Mama Gabriele, whatever. And he's completely, he has a mental problem, literally. But he has a lot of followers who listen to him. And some of the people send me his videos, and he said that he find the connection between vaccines, COVID vaccine and HIV. I said, like, what are you talking about? Completely. And he said, I'm a medical doctor. It's really, yeah, you're laughing, but the people are really, really, really listen. And we don't have a mechanism to say, like, shame and blame. We don't have it. Unfortunately, I'm very angry and I was disappointed with the fact checkers in Georgia because fact check is a very good initiative. Unfortunately, this fact check, whatever we have in Georgia, they are politically motivated. They're only doing political things. And only, it's very funny, they're very biased. Whatever is against their political establishment, everything is wrong and only they're right. So it was really sick. So this was the one reason why I was really hoping that somebody else will do it. And some of these political motivated guys with not PhDs, but just some medical degrees, they also try to do this fact check broadcast and podcast or whatever. It didn't work. Very simple. Because when you say something, you should be clean, you should be independent, and you have to be based on science. As simple as this. So that's why we started this 10 days ago, this new initiative, Fact Check Health Georgia. It's a part of the Public Health Institute of Georgia initiative, and it's hosted in Sheni Ekimi, one of the biggest public health platform what we have at the moment in Georgia. It's very proud because more than 3 years we're working on it. And all in all, we're producing around 70 articles per day. It's quite a lot. And we're covering different topics, and we try to do our best, but still it's not enough. Still not enough. Any other questions?
Professor Giorgi Pkhakadze, you mentioned about these fake drugs that are ineffective. And could you tell us what harm do these fake treatments cause despite and beyond the obvious financial loss?
Okay, so the problem with the fake drugs. For example, the guys say that, oh, we have special protocols or we have special vitamins or you have a part of the program. No, no, no. We don't know what's inside these pills. Because the problem the worldwide, this is we have a global challenge. The worldwide, all the supplements, they are not regulated same as drugs. As a result, you don't know what's inside. They are considered as a food supplements. It's like a food. You buy apple. So there's no regulation at all. It means that you go to pharmacy, you think that you go to pharmacy, and you think you're buying some drug, but in reality, you're buying supplements which has nothing to do with drugs. First, there is nobody who will check what is inside this substance. Second, we don't know how it was packaged, the pills, and how it was packaged in the box. We know that we have now big epidemic of the microplastics. Do you know how many, I'm like, people think like they're taking, first of all, what they're taking, this is another story. They say there is a vitamin. Who said there is a vitamin there? Who checked? There's any evidence? People producing things where there's no any certificate of quality, not even research. And when I propose to the supplement company, let's check. Nobody come. You know, we started this initiative a couple of months ago. It's called Safe Supplement Georgia. We did the platform. We opened to everybody. Okay, come, apply. None of the organizations in Georgia apply. Why? Because they are fake. My conclusion in Georgia is, I'm not talking about globally. In Georgia, the supplements which come to Georgia, they are not safe and they're not effective for sure. And why they're not safe? Because there is no evidence what we have inside these drugs, inside these pills. After how it's packaged, the packaging system, there's a cheap one, which is full of microplastic, and the expensive one. Do you think the supplement which is cost 100 for even one guy used to sell supplements for 10 lari D vitamin? Come on. I mean, it's impossible. So, and also the packaging outside, the box when it's done, and also even the paper, it's a toxic papers. So issue is that because they try to make as cheap as possible, the product become very toxic. The starting point when you open in the box, when you open the things, and it's full of microplastic. Instead of get a cure, you're getting additional plastic in your brain, in your heart, in your other organs. This is the problem. So, and on top of all of this, you think that you are safe. You think that your organism needs magnesium or iron or vitamins. Or particularly, this very funny one when they say, oh, one vitamin, you have 25 vitamins in one pill. It's impossible because our organisms cannot
Water
absorb.
and fat soluble.
Yeah, it's simply impossible. Only have a one guy. Unfortunately, he's a doctor. I see that he studied medicine. I don't know he has a diploma or not, but he studied even in US, and he bringing something from Sri Lanka, some kind of things, and he's selling D vitamin for $1. I criticize him. Of course, he blocked me afterwards. I said, like, can you give me certificates? What the hell are you doing? And the people think that, oh my God, oh, okay, the fish is very expensive, so maybe I will buy this vitamin and it's giving me the same thing, but it's not giving you, it gives you more harm. In the good scenario, it gives you nothing. In the good scenario. But majority of the cases, the cheapest the product, the cheapest packaging, more hazardous plastic, and you will have even have some other diseases like cancer and other diseases. So we have to think about this, and the best way to do it, just see like what's the cause of your problem, and to see like maybe you have to do exercise, just 10,000 steps per day. Maybe it's a good idea. Maybe just go 30 minutes outside and see and to see the sun. So this actually can help you to have 5 fruits and vegetables every day, different fruits and vegetables. This is all the collection of vitamins you need. And once in a while to have a fish, once in a while to have a chicken. So, and this is the way how we move forward. But all the supplements, they are really, really harmful. And more time goes, more I'm really concerned about Georgian population because you know what's happening? Even the doctors, they're prescribing this, they're prescribing one drug which costs maybe 2 lari, and they prescribe 200 lari supplements. And the majority of Georgian population are not very rich, and particularly in rural areas. I saw they targeting these poor grandmothers and grandfathers. They say, oh, you have to, and they're spending their last money. Instead of to spend money on really vitamins or really food or really things, they're buying these stupid things. And this is disaster because this is money which actually can go to really their health. Instead of that, it's go for nothing. And unfortunately, it's not only just bad product, but it's also harmful and dangerous. And it's already in Georgia, we have an epidemic. And the government, unfortunately, not taking adequate steps because the companies who was managing in Georgia, there are a couple of companies. The three companies, one is the Avex Medical Corporation, and they are GSG, and our Aversi company, and third one PSP. So there's three main pharma companies. They have hospitals, they have universities, they have everything. They have members of parliament, and so you cannot do anything in Georgia, unfortunately. And for 30 years, we're moving direction that nobody really thinks about public health in Georgia. Everybody thinks how to sell drugs and how to sell supplements. And of course, you have a lot of the small companies because big companies are making big money, and small companies, okay, why not to use this opportunity? And they're doing whatever they can using TikTok, YouTube, Facebook, Instagram, and try to do the things. But we don't have this national-wide agreement that public health it's our business, and if our population will be healthier, it's good for our economy. We'll be much more stronger. C'est la vie. Any other questions?
Uh, Professor Giorgi Pkhakadze, nowadays, many companies and many influencers, well, they are particularly famous. They promote fake anti-aging or longevity products. And what do you think? What does real science actually say about extending human lifespan?
Billions of dollars are spent on this because a lot of rich people, they want to live longer and they want to be immortal. And this is a question not only for now, even the Egyptians, they want to be immortals. And the first day when the persons uh, create science, they always ask the alchemists and the priests to find the immortality things. Egyptians, they find the way that, yeah, don't worry, you will die here, but you have immortality afterlife. So different communities, religions, and people, they find different way to do it. So far, we don't have the drug. We don't have a treatment. We still in the surface to understand how it works. Yes, we do have some researchers, which is experiments on the rats. And we have this famous billionaire who tried to reverse his age, and he making a lot of money out of that.
Brian.
You have, yeah, Brian, yeah. And you have also, you do have some treatments, and you have procedures, which is very expensive, by the way. There is several one. Actually, it's booming in China, by the way. You will be surprised that in China, in US, in Europe, you have more regulation one. And you have it in Dubai, and I have one guy, he's opening a clinic in Lagos. Can you imagine? It's Lagos. And we can see where there's a lot of money, so the people want to invest on this. But we don't have 100% evidence to show that actually can reverse aging. Does not exist. You also don't have any proven, scientifically proven drug or substance to say like this particular drug or this particular substance will reverse aging. However, what based on the research and the science said like quality of life can improve your lifespan, and it's a combination of many factors: food, nutrition, what you eat and how you eat and how much you eat, your physical activities, starting from sleeping, walking, exercising, your mental health when you rest and have more time to socialize, and many other issues. So combination of that, and there is some procedures which is still on testing ground. I cannot say no, but there are some drugs or some, I can say, substances would actually support, I will try to say, support all this process. And there is some researches are on the way. And I strongly believe with the help of the AI, we're going to get very good results in the coming years, not in coming decades, in coming years. Yes, it's true by 2030, I strongly believe we will have individual medicine when the drugs will be designed for the patient individually. And this also part of how we can manage our aging? Is a millennium question. It's really everybody want to know where we're going to have these drugs. I think it will come because there are very promising researches in and out. You can see it. A lot of research conducted on the animals, poor animals. Some of their even they start to do in the human trials, but we don't have any like fact. I can say like you take this drug, you'll be okay. We don't have it anymore. We don't have it yet, but I believe we will have. And there are, how to say again, if you create an environment, it may help to support to improve your quality of life. I think that what is important, not that you live 200 years, but how you live this 200 years. And the quality of life is more important when just it's like not the quantity, the quality is important. Any other questions?
Professor Giorgi Pkhakadze, in your experience, what is the most dangerous health myth spreading right now? Because social media is a major source of misinformation. Do you think that platforms have a bigger responsibility to control it, or is it up to individuals to be informed?
I think it's a combined thing. I have a personal experience. For example, we put many news in our Facebook account, and my Facebook account constantly banned or blocked because, for example, I put the article about harmful use of marijuana because it is harmful, and we know that person below 45 should not try it. It's a we have evidence that if the person below 44 even tried the marijuana, it has direct impact on his brain cell. This is fact. And on top of it, we have now new drug things coming, and they have a new synthetical drugs. And I just put the warning message in Facebook, and Facebook actually banned me to say like I'm promoting drugs. So, and the problem if and I did the reporting, I sent the messages, zero response. So I think that here that even I have a verified Facebook account, still Facebook is not doing its job. I'm very grateful for the Zuckerberg and Facebook because we're doing a great job. However, there is a should be some mechanism like if it should be verification, not only just verification, but it should be verification. You are a medical doctor, so my medical messages should be approved. And if you are not medical doctor, and it should be recorded, I think that it should be very tough. You should submit your diplomas, you should submit your research papers and everything, and only after, even after that, we still have a problem, but at least you should minimize the things. And there's a responsibility of a TikTok or YouTube or Facebook or Instagram, Snapchat, Telegram, all these guys. They should, it is their responsibility. They can say, oh, it's not our responsibility. No, it's not true. Because average person, how the average person can understand? It's impossible. And you as a company making billions of dollars and very proud, oh, I have billions and billions and billions. No. And also when you have this kind of issues, I'm like, now is AI taking over. I didn't get the response from Facebook. It's only AI just is to get AI respond. And I talk to the AI agent and I said, you are not human, you are AI. No, no, I am a human. But I see it was a machine who was talking to me. And I say, I do have a problem. Please fix it. Yes, 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 but they cannot fix because I said, you say, I'm a human. I'm a professor. Look at my credentials. When I say something, this is means, and it should be also the value. Who said what? For example, I'm sorry to say, like you are still, you want to be a student, you want to be a doctor, but my word, the scientific word, and your word should be different. And it should be also vetted differently. Like if you took the star from 0 to 5, okay, you put 0.5 because you tried to do something. But when I say something, it should be at least 4. I'm not saying 5, but because this weighting system should also be very clear. And why? When Professor Pkhakadze said, if I will say something about ophthalmology, my rating should be down because I'm not expert in ophthalmology. But when I say something about public health, my voice should be higher than anybody else in the room who are or similar persons with similar background. So this system is not yet there. And plus we have our AI now. We have in Georgia, I see there is several websites now There's not even a human there. It's just AI guy, robot, like literally robot speaking. And it's completely AI generated content. Who is behind it? And this person, and I see it's hundreds of thousands of followers and the comments. And education, education, again, education, because nowadays, how to say, before we write scientific people, we write one article every 3 months. And it was like, wow, you write so many articles. Usually you write one article per year. Now you have to do 5 posts per day, and it's not enough because people are not reading, they're scrolling. That's why we do these reels now. At Public Health Institute of Georgia, we created 700. We by the September we'll have 1,000 reels published, and we realize that we're writing articles, nobody read them. 90% people don't read, don't open the article, they only see the picture and the title. They do the comments and everything. We have 1.3 million followers on all our Facebook pages. And on monthly basis, sometimes we're going up to 30 million views in all our Facebook pages, and our web pages we getting sometimes up to million, but this is like sometimes when some scandalous news going there. What I try to say, even producing such a huge amount of information, we're still not reaching everybody because people are scrolling. And can you imagine how much you have to produce to end up in the scrolling things? It's difficult. And plus you have AI now producing multiply by 1,000. So we are the human people. So when Public Health Institute of Georgia publish something, we're checking, we're verifying, we're looking at references. But the guys is simply AI say, okay, write me 100 articles about vitamins. That's it. And now publish them. And this AI will publish every 10 minutes article about vitamin. And the problem is that when you are the user, you're getting these hits, you're getting this news even by scroll. And maybe after 50, maybe 51, you click the button, what is this? And this is how you end up to get the fake news. So we are in trouble. So I think the responsibility of AI and social media is very high. It's not only responsibility of the user. This is not correct. When they put everything on the user, I think it's wrong. I think the platform they have, all the platforms they have high responsibility, and they're responsible because they are the one who's spreading the news. They are the one who's spreading the hate news. How it's possible that I'm reporting the haters, literally haters who actually, during COVID, there's a lot of anti-vaxxers. I report to Facebook, and Facebook never took down these accounts. The question is why? Why on earth? Because
Probably they think that's democracy.
now the question is that if you look for algorithm of the Facebook, more haters, the haters are more active in Facebook, and haters give them more traffic. That's it. This is the reality. And they hate, so it's like it's algorithm of the Facebook that more you write hating thing, the wrong things, they have more traffic, and the Facebook promote you. When I put a message, I give you my example. I'm putting very peaceful message, I love you, everything is okay, no. Okay, 5,000 views. When I say something, we have a problem with my face is a little bit angry, 100,000 views. Same person, difference 10 minutes. Can you imagine? 2 messages. Don't tell me there's people interested. No, it's an algorithm is pushing this. Algorithm pushing things which is negative. Algorithm is not pushing things which is positive. Unfortunately, this is the reality where we are, and we have to learn, we have to adapt, and this is a big challenge for all of us. But we have to learn and be optimistic and try to find best solution available.
Professor Giorgi Pkhakadze, do you think that nowadays public health experts lack respect from the society? And also, what tools or methods can the public use to fact check health claims nowadays?
Unfortunately, during COVID, public health structures, not only in Georgia, in many countries, went through the big challenging time. People don't trust them anymore. We have a problem, global trust to the public health systems. We do have and people don't accept this. People don't even acknowledge, but we do have a challenge. People don't trust public health systems. And we have to gain this trust back. Unfortunately, public health systems, many countries, including Georgia, they're still thinking in very 20th century thinking. They talk about publishing brochures, and come on, guys. You have to do reels. You have to do social media. You have to be in TikTok. And not once a month. You have to do 5 times a day. So this is the reality. But the people who are there, they're still thinking old-fashioned. It's like dinosaurs, and the dinosaurs are extinguished. They don't exist anymore. And unfortunately, this is where, and by seeing this, the Public Health Institute of Georgia become de facto NCDC, National Center for Disease Control and Prevention in the country. If you look the amount of information, and type of information, and type of impact we have on Georgian society, we're the highest and the strongest messenger of public health in the country. And we are not funded by anybody. We're completely independent. And the reason why I think we're successful, because when the reader reads or see message, they see it's not bought by the pharma company, not bought by politicians, and not bought by somebody. We're just saying whatever is based on science. And even people criticize us, but they know we are right. Because we try to do our best. When we publish something, we always check, recheck. Of course, we may have a mistakes. I mean, like you produce 70 news per day, you may have a mistakes, it's fine. However, it's not intentional. And if you find a mistake, we immediately change it and we update it, apologizing and stuff like that. But what I try to say that public health systems are collapsed. And Georgia is one of the good example how the National Center of Disease Control and Prevention is completely not exist for Georgian society anymore. Did you hear any message from the NCDC recently? Zero. Where is the NCDC where we have this nutrition test? Even the food safety department, they say, yeah, there's a problem. Where is the NCDC, where the National Center of Disease Control and Prevention in Georgia, where we have these fake tests? They're doing HIV, Hep C, and syphilis tests. I put it publicly. Why there is no reaction from the National Center of Disease Control and Prevention? This is their direct responsibility because it's harmful for the population. It's a public health concern. Why they don't do this? And this is the problem, that when you don't react, the more time goes, more your reputation is gone. And here you see the reputation on NCDC, it's going down day by day. And Public Health Institute of Georgia, our flagship website, Sheni Ekimi. And we also now we have now, even you can go to the Apple and Google Store. You have a now application called Sheni Ekimi. You can do it, Sheni. Sheni in Georgian means yours, like your doctor in Georgian is Sheni Ekimi is your doctor. So your doctor in Georgian, its application is there. And we see every day increased number of usage. It's incredible. So, and don't forget, we don't have a boosting. We don't pay for publicity. We don't put the things, we don't do publicity in TV. As you can see now, it's not an issue in the country. But still, the number of people who see and listen is increasing. So it means that real news is still valued. Even we have a challenge with ChatGPT, we have a challenge with all other AIs, we have a challenge with a lot of fake news, but the real news is always in demand.
Well, I think these institutions need to be stronger, and public health experts should strengthen them as much as they can. Uh, Looking ahead 10 years, what would you say? What public health issue worries you the most?
I think the addiction will be the biggest problem. I think addiction is taking over globally, and it's related to depression. It's related to the unemployment. It's related to social changes worldwide. It's not only in Georgia. I think it's a global problem will be, and we have to face it. Addiction. I was in Brussels. I was in Belgium, one city, and it's just one city. I think Chateau Gontier. I know. I forgot the name. The second biggest city, and it's disaster. Once richest city in Belgium with big industries, beautiful architecture, and you go in city, it's only drug addicts, and it's scaring and
So,
scaring such a scale. I just tried to find the city name. It's such a scaring that um, that you see what is the solution or what can be done and how we find this. I mean, you need to have a solution because um, people have problem. Okay, I found the name. The city is called Charleroi.
Frenchman.
Charleroi. It's in Brussels, and sorry, it's in Belgium. And I was in that city, beautiful city. They have an airport, they have a railway station, all the infrastructure possible on earth, but it's completely taken over by drugs. And you can see that even the strongest societies, how they can collapse. So I think that one of the biggest problems what we face globally, including Georgia, is drug addiction. We have to take it seriously. But nobody want to take it seriously. Nobody want to make a decision because decisions are very tough. And many decision makers, they're also drug users. This is another problem. This is, I think, the biggest challenge, public health challenge, what we're going to face. The second, I still believe, is obesity. We become fat, and because of a lifestyle, talking about the food, exercise, stress, and everything. I think the second biggest problem we have obesity. Obesity is also responsible for the many chronic diseases, and it's also a result of many chronic diseases. So I think that from a public health point of view, this we have to look at the complex part, and we have to make it like a small pieces and try to things not like you take the Ozempic, which is by the way it's not a good idea to take it, or to have bariatric surgery, which is I'm still against it because I think that in Georgia particularly what's happening is unacceptable. And I had this big campaign which actually worked. I started about the bariatric surgeries, and after everybody was against me, but after they accepted that yes, it's not true, and they apologized it. But anyway, so when we talk about public health, we have to look the bigger picture, and of course, the third one, as a public health, our mental health. We sometimes we're forgetting we are living in very stressful environment. I think that 10 years time, this free direction, maybe other things will come up, but this is how I see the challenges. And of course, all the three are interconnected. They're not separate. And but we have to see how the society can grow and be mature and be bold enough to make bold decisions, which is very difficult. But I still believe that humans, we do a lot of mistakes, but after we do the right decisions.
Professor Giorgi Pkhakadze, let me ask you the final question, which I think is touching to many people. In the era of artificial intelligence and this competitiveness, what advice would you give to young people who want to work in public health or science communication?
I think the first thing you have to learn. I think that it's important you have to know the tool. For me, AI is a tool. I'm using it. I love it. I'm discussing it. I'm chatting with it, and it's great. And I don't think that not to you. Some of my colleagues, oh, we should not use it. No, I completely disagree. We should use it. But one of the things with the AI is that AI is assistant. It's helping you. But you have to be clear, that it will not replace you. It's up to you. It will replace you or not. So your basic knowledge your humanity and your sense of humor and the way of communication is very important. You have to communicate and you have to learn. But when you think that AI can do everything for you, this is where the trouble starts. A lot of students, they're using AI to write the essays. They're asking AI, okay, give me the summary. The reason why the professor is asking summary, not because they want your result, they really want that you read this paper, you analyze it, and you come up with your idea. But if AI will give us idea, what the sense? It means that AI will replace you. It will. Many professions will disappear in the coming years, not decades, in the coming years. Even the medical profession, for example, some of the profession which require like manual work, like before it was very, very, very prestigious, very well paid, like radiologists, they will be gone because machine can do very good reading because it's very much technical things. So laboratory readings, yes, machines will do the much better readings. So, and we see that as a result. However, there is something logic behind it. Yes, the machine can give you mechanical logic, but the humans are not a machine. This is the thing. You still need to have, sometimes you have this guts, you have this feeling, and sometimes you have to touch no, sometimes you have to touch the patient. We don't touch patients anymore in medical field because of a computer, we have to fill out the forms. But I think that I see AI as a positive part that maybe AI will help us. The doctors will start to touch and discuss and spend time with the patients, which is not happening anymore. Doctors see screen, but don't see the patient. They even like, okay, what is your name? They type and they're writing everything on computer. Don't even look to the patient. And I think all of these mechanical things can be done by the AI, and doctor will spend more time with the patient to talk to them, give them human touch. Just simply, of course, the pulse can be measured by machine 1,000 times better, but the human touch, it have a connection. And for patients, it's very important. They feel much more secure. Much more say. There is one research shows that whereas the doctors, they're wearing just normal shirts, and the doctors are wearing white coats. They look like a doctors. The patient feel much more comfortable to see a doctor with the white coats. You see, it's a psychological things. And you have a machine next to you, have a robot. Okay, maybe a robot will be 10 times better. Now research shows even 45% better. But anyway, so I think that we have a shortage of the doctors and medical professionals. And I think AI will be a great tool to support us in medical field, including public health field. And I think we'll be able to do it. And we have to use it as a positive tool to help us to move forward, be stronger, and be everywhere. This is the key point. But the question is that if we resist, more we're going to lose. I think we should not resist. We should opposite. We should take it and use it. Bring in our everyday life. And I strongly encourage all students use and learn how these tools are working, what they give to us, and how they can be used in everyday life. And no misuse it. If you're using AI, say I'm using AI. For example, when I write articles, my Georgian is not perfect. But what I do, I'm writing articles in English, and I have to say, okay, translate it to Georgian and make my style, because I have my style of writing. So it gives me the things. And of course, when it's writing me articles, I'm not directly copy paste, I'm checking. So this is a different things, because even one word in one sentence may be completely misleading. So even for me, AI is just a technical assistant, it's a secretary. So you have to use that as a secretary, but not as your ultimate decision maker. And many articles prepared by the AI, I didn't publish because I disagree. And sometimes I have to completely write it. Sometimes AI has its own problems. But what I try to say, when I publish something in Facebook, I'm using AI as an assistant, but not the writer. It's helped me to clean the grammar, make a nice bullet points, put nice emojis. It's perfect. I'm saving at least 15, 20 minutes. But the idea is coming from me. The content comes from me. The references come from me. You see what I mean? So this is the way what you have to say. Yes, you should use, and instead of to publish maybe one article per day, now I can do 10 articles per day. because I save a lot of time. So I think from this point of view, this is what we have to use. And I still believe that AI is the greatest invention what we have. We have to be careful. There's a lot of challenges connected to this, but we have to learn and use it from now. All students should use it. All schools should use it. And we have to say how we can make maximum out of it. And we have to learn to live with the AI.
Well, I think that's very good advice for young people because the era we are living nowadays and today is full of machine learning and artificial intelligence. And also, I completely agree that we need to use ChatGPT and artificial intelligence properly. Professor Giorgi Pkhakadze, thank you very much for participating in my podcast. Again, it's my honor hosting you today, and I wish you all the success in your future public health endeavors.
Thank you very much. And also, I wish you all the best in your podcast. And I hope that this is one more additional tool of communication and you have to use it. And I hope we are going to meet soon to discuss some other topics. So I wish you all the best and I wish you, that all our listeners enjoy our talk. Have a nice day.
Thank you very much.